So women will often present to me for fertility issues or alternatively for pelvic pain type symptoms, and alternatively also heavy menstrual bleeding. And there can be a multitude of reasons why women need to have a laparoscopy, and they will include the treatment of endometriosis or alternatively fibroid disease. So a laparoscopy is a means of being able to look inside the pelvis without any major cuts. So it's basically keyhole surgery. I place a fine camera, a very small camera, into the belly button, and then there's 3 additional small little incisions that are made, about 1/2 centimetre, that are located in 3 different spots around the belly. What we do is we fill the tummy full of gas, and this allows us to be able to look inside the pelvis and be able to see if the uterus is structurally normal and if there's any things that potentially might prevent a woman from becoming pregnant or alternatively causing her pain or heavy menstrual bleeding. So if there's a fibroid, we can actually remove the fibroid from the uterus and then sew the uterus back up. If there's endometriosis, I can cut the endometriosis out and then remove it and send it off to our pathologist to confirm the endometriosis is there. In addition to that, we also, and I often do, perform a hysteroscopy, which is a camera that's inserted into the uterus to have a look inside the uterus. You've got to think about the uterus as an oven which we're going to bake a bread in, or in this case, plant a little baby in there. So the uterus needs to be structurally normal, not only in its musculature, but also on the inside of the uterus. So making sure there's no polyps or fibroids that might prevent a pregnancy are going to be particularly important. Now, of course, the last thing we often do at a laparoscopy is confirm tubal patency. And so what I mean by that is making sure that the tubes are open. I place a small little catheter into the uterus and flush some blue dye through the uterus and out through the tubes. And if the tubes are open, it means that we know that when an egg is released from the ovary, that it'll be able to travel down the tubes where fertilization occurs. In actual fact, the mere fact that I've actually done a tubal patency test will actually spike pregnancy rates. So we know that a tubal flush is sometimes all women need in order to achieve pregnancy. Now, there are some risks associated with a laparoscopy. They are very small, but you need to know about them. It's a little bit like driving a car. Every time you get into a car, there is a very small risk of course, having a car accident and, unfortunately, having a major car accident and dying. And whilst you're not told that every time you get into a car, we as a medical profession need to tell you about the risks associated with any type of surgical procedure. Now, they are small, but the major ones are bleeding, infection, potential damage to internal structures. Now, that includes bladder, bowel, nerves, arteries and veins. Now, in a very much a life-threatening measure, or if there's any potential damage to those areas, would we need to do something like a small caesarean section scar to repair those particular things? Now, of course, they are very few and far between. As with any type of surgery, there can be catastrophic bleeding, and in very, very, very few cases, there can also be some anaesthetic complications that can result in terms of the laparoscopy. Of course, a lot of the information you can find about laparoscopy are not only located on my website, but also through RANZCOG, which is the Royal Australian New Zealand College of Obstetrician and Gynaecologists web link to the laparoscopy surgical procedure.